Question. A client is admitted with suspected appendicitis. What is the priority nursing action? A. Administer pain medication. B. Place the client in a supine position. C. Apply a warm compress to the abdomen. D. Prepare the client for surgery. Answer. D. Prepare the client for surgery. Rationale. Appendicitis often requires surgical intervention. Priority nursing action is to prepare the client for surgery to prevent complications like rupture. Question. A client is diagnosed with major depressive disorder and is prescribed fluoxetine. When should the nurse inform the client that therapeutic effects may become noticeable? A. Within a few hours of the first dose. B. After 1 to 2 weeks of consistent use. C. After 4 to 6 weeks of treatment. D. Only after the medication is discontinued. C. After 4 to 6 weeks of treatment. Rationale. Fluoxetine and other selective serotonin reuptake inhibitors, SSRIs, may take several weeks to achieve therapeutic effects. Clients should be informed about the delayed onset of action. Question. A client with heart failure is prescribed enalapril, ACE inhibitor. What is the nurse's priority assessment before administering the medication? A. Blood pressure. B. Respiratory rate. C. Serum potassium. D. Urine output. Blood pressure. Rationale. ACE inhibitors are commonly prescribed for hypertension. Before administering, the nurse should assess the client's blood pressure as these medications can cause hypotension. Question. A client with chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy. What is the nurse's priority action when administering oxygen? A. Administer oxygen via a non-rebreather mask. B. Ensure oxygen flow rate is below 2 liters per minute. C. Monitor for signs of oxygen toxicity. D. Encourage the use of a Venturi mask. Answer. C. Monitor for signs of oxygen toxicity. Rationale. Oxygen therapy can lead to oxygen toxicity. The nurse should monitor for signs such as confusion and respiratory distress. A client is admitted with a suspected myocardial infarction. What is the priority nursing intervention during the acute phase? A. Administer thrombolytic therapy. B. Encourage fluid intake. C. Apply a heating pad to the chest. D. Administer anticoagulants as ordered. Answer. A. Administer thrombolytic therapy. Rationale. Thrombolytic therapy is a time-sensitive intervention to dissolve clots in the coronary arteries and restore blood flow during a myocardial infarction. Question. A client is receiving total parenteral nutrition, TPN. What is the nurse's priority action to prevent complications? A. Monitor blood glucose levels. B. Administer TPN at room temperature. C. Change the TPN bag every 72 hours. D. Increase the TPN infusion rate gradually. Answer. A. Monitor blood glucose levels. Rationale. Monitoring blood glucose levels is crucial to prevent hyperglycemia in clients receiving TPN, especially those with diabetes or compromised glucose metabolism. Question. A client is prescribed isoniazid for the treatment of tuberculosis. What assessment finding requires immediate intervention? A. Decreased appetite. B. Yellowing of the skin and eyes. C. Tingling and numbness in the extremities. D. Photosensitivity. Answer. C. Tingling and numbness in the extremities. Rationale. Peripheral neuropathy is a potential side effect of isoniazid. The client should be assessed for symptoms such as tingling and numbness, and pyridoxine, vitamin B6, may be recommended. Question. A client is diagnosed with heart failure. Which assessment finding indicates fluid retention and congestion? A. Increased urine output. B. Decreased jugular vein distension. C. Crackles in the lung bases. D. Hypotension. Answer is C. Crackles in the lung bases. Rationale: crackles in the lung bases suggest pulmonary edema, a manifestation of fluid retention in heart failure. Question. A client is prescribed levothyroxine for hypothyroidism. When is the best time for the client to take the medication? A. With breakfast. B. Before bedtime. C. On an empty stomach in the morning. D. With a high-fiber meal. Answer C. On an empty stomach in the morning. Rationale: levothyroxine should be taken on an empty stomach in the morning to maximize absorption and prevent interference with other medications or food. Question. A client is receiving heparin therapy for deep vein thrombosis. What laboratory value should the nurse monitor closely? A. Platelet count. B. Activated partial thromboplastin time, APTT. C. Prothrombin time, PT. D. International Normalized Ratio, INR. Answer. B. Activated partial thromboplastin time, APTT. Rationale: heparin affects the intrinsic pathway, and monitoring APTT helps ensure the therapeutic range and prevent bleeding or clotting complications. Question. A client is prescribed digoxin for heart failure. What sign indicates a therapeutic effect of the medication? A. Decreased heart rate. B. Increased blood pressure. C. Elevation of body temperature. D. Rapid respiratory rate. Answer. A. Decreased heart rate. Rationale: digoxin helps improve cardiac output by slowing the heart rate and enhancing myocardial contractility. Question. A client is diagnosed with hyperthyroidism. What dietary teaching should the nurse provide? A. Increase iodine intake. B. Limit foods rich in tyramine. C. Encourage a low-fiber diet. D. Restrict caffeine intake. Answer A. Increase iodine intake. Rationale: iodine is a necessary component for thyroid hormone production, and increasing iodine intake can help manage hyperthyroidism. Question. A client with chronic renal failure is prescribed epoetin alpha. What is the expected therapeutic outcome? A. Increased blood pressure. B. Improved blood glucose control. C. Enhanced red blood cell production. D. Decreased serum potassium levels. Answer C. Enhanced red blood cell production. Rationale: epoetin alpha stimulates erythropoiesis, leading to an increase in red blood cell production. Question. A client is admitted with suspected meningitis. What precautionary measures should the nurse implement? A. The standard precautions. B. Droplet precautions. C. Contact precautions. D. Airborne precautions. Answer B. Droplet precautions. Rationale: meningitis is primarily transmitted through respiratory droplets, warranting droplet precautions. Question. A postoperative client is at risk for thrombophlebitis. What nursing intervention is essential for prevention? A. Encourage immobility. B. Apply warm compresses to the affected leg. C. Administer anticoagulant medications. D. Elevate the client's legs above heart level. Answer C. Administer anticoagulant medications. Rationale: anticoagulant medications help prevent thrombophlebitis in high-risk postoperative clients. Question. A client is prescribed lorazepam for anxiety. What information should the nurse include in the client's education? A. Increase the dose if anxiety persists. B. Abruptly stop the medication if side effects occur. C. Avoid alcohol consumption. D. Take the medication with food. Answer C. Avoid alcohol consumption. Rationale, lorazepam is a central nervous system depressant, and concurrent alcohol consumption can potentiate its effects, leading to respiratory depression. Question: a client is diagnosed with pneumonia. What is the nurse's priority assessment? A. Blood glucose levels. B. Serum potassium levels. C. A respiratory status. D. Bowel sounds. Answer: C. A respiratory status. Rationale, pneumonia primarily affects the respiratory system, making respiratory status a priority for assessment. Question: a client is diagnosed with pneumonia. Question: a client is receiving chemotherapy and reports mouth sores. What nursing intervention is appropriate? A. Encourage hot beverages. B. Provide spicy foods. C. Offer frequent mouth rinses with normal saline. D. Administer acidic foods. Answer is C. Offer frequent mouth rinses with normal saline. Rationale, mouth rinses with normal saline help soothe and clean the oral mucosa in clients experiencing chemotherapy-induced mouth sores. Question: a client with a history of seizures is prescribed phenytoin. What laboratory value should the nurse monitor closely? A. Platelet count. B. Serum potassium levels. C. Liver function tests. D. Serum phenytoin levels. Answer: D. Serum phenytoin levels. Rationale, monitoring serum phenytoin levels helps ensure therapeutic efficacy and prevent toxicity. Question: a client is admitted with a suspected upper gastrointestinal bleed. What is the nurse's priority action? A. Administer antacids. B. Administer a proton pump inhibitor. C. Monitor vital signs and assess for signs of shock. D. Encourage a clear liquid diet. Answer: C. Monitor vital signs and assess for signs of shock. Rationale, upper gastrointestinal bleeding can lead to shock. Monitoring vital signs is crucial for early detection and intervention. Question: a client with diabetes mellitus is prescribed insulin lispro. When is the peak action of this insulin type? A. 30 minutes to 1 hour. B. 1 to 2 hours. C. 3 to 4 hours. D. 6 to 8 hours. Answer: A. 30 minutes to 1 hour. Rationale, insulin lispro has a rapid onset, with peak action occurring 30 minutes to 1 hour after administration. Question: a client is receiving heparin therapy and reports coffee ground emesis. What is the nurse's priority action? A. Administer an antacid. B. Assess for signs of bleeding. C. Encourage increased fluid intake. D. Document the finding. Answer: B. Assess for signs of bleeding. Rationale, coffee ground emesis may indicate upper gastrointestinal bleeding. The nurse should assess for signs of bleeding, such as melena and changes in vital signs. Question: a client is prescribed warfarin for deep vein thrombosis. What should the nurse include in the client's education? A. Avoid foods high in vitamin K. B. Increase intake of green leafy vegetables. C. Take aspirin for pain relief. D. Skip a dose if feeling unwell. Answer: A. Avoid foods high in vitamin K. Rationale, vitamin K can interfere with the anticoagulant effect of warfarin. Clients should be advised to maintain a consistent intake of vitamin K containing foods. Question: a client is diagnosed with rheumatoid arthritis. What is the nurse's priority teaching regarding methotrexate therapy? A. Take the medication on an empty stomach. B. Consume a diet high in calcium. C. Avoid alcohol consumption. D. Administer the medication as needed for pain. Answer: C. Avoid alcohol consumption. Rationale, methotrexate and alcohol can both affect the liver. Clients should be advised to avoid alcohol to prevent liver damage. Question: a client is admitted with a hypertensive crisis. What medication is the nurse most likely to administer for rapid blood pressure reduction? A. Amlodipine. B. Nitroglycerin. C. Losartan. D. Sodium nitroprusside. Answer, D. Sodium nitroprusside. Rationale: sodium nitroprusside is a potent vasodilator used for rapid blood pressure reduction in hypertensive emergencies. Question: A client is prescribed albuterol for asthma. What education should the nurse provide regarding this medication? A. Use as needed for acute attacks. B. Take daily for long-term control. C. Rinse the mouth after each use. D. Take with food to reduce gastrointestinal upset. Answer is C. Rinse the mouth after each use. Rationale: rinsing the mouth after using albuterol helps prevent oral fungal infections, a common side effect. Question: A client with chronic kidney disease is prescribed a low-phosphorus diet. What food should the nurse instruct the client to limit? A. Dairy products. B. Fresh fruits. C. Leafy green vegetables. D. Whole grains. A. Dairy products. Rationale: dairy products are high in phosphorus and should be limited in clients with chronic kidney disease to prevent hyperphosphatemia. Question: A client is admitted with a head injury. What is the priority nursing intervention? A. Administer pain medication. B. Maintain a flat head position. C. Encourage deep breathing exercises. Answer, D. Assess neurological status. Rationale: assessing neurological status is crucial for detecting changes that may indicate worsening intracranial pressure or neurological deficits. Question: A client with a history of heart failure is prescribed spironolactone. What laboratory value should the nurse monitor closely? A. Blood glucose levels. B. Serum potassium levels. C. Liver function tests. D. Serum sodium levels. Answer, B. Serum potassium levels. Rationale: spironolactone is a potassium-sparing diuretic, and monitoring serum potassium levels is essential to prevent hyperkalemia.